Top 12 Best Ways to Stop Frequent Urination at Night Nocturia. Are you tired of waking up multiple times at night just to use the bathroom? Frequent nighttime urination, also known as nocturia, can disrupt your sleep and leave you feeling exhausted the next day. If this sounds familiar, you're not alone. Many people experience nocturia, whether it happens once or several times a night. This ongoing disruption can be frustrating and impact your overall well-being. But what if there were simple, effective ways to manage and even reduce these nighttime interruptions? Fortunately, there are. In this guide, we'll explore the top 8 methods to help you stop frequent urination at night so you can finally get the deep, restful sleep you deserve. Make sure to read until the end. Our final tip could be a game changer for your nights. 1. Limit fluids before bedtime. One of the simplest and most effective ways to reduce nocturia is to limit fluid intake in the hours leading up to bedtime. Experts recommend cutting back on drinking liquids, especially diuretics like coffee, tea, and alcohol, about 2 to 3 hours before you sleep. Diuretics increase urine production, making you more likely to wake up for a bathroom trip. Instead, try to drink most of your fluids earlier in the day and take only small sips in the evening to stay hydrated without overloading your bladder. This is particularly helpful for those experiencing age-related hormonal changes, such as a decrease in antidiuretic hormone AD, which normally helps control urine production at night. Lower ADH levels can lead to higher urine output, worsening nocturia. Certain medical conditions, such as heart disease, diabetes, and prostate issues, can also contribute to nocturia. Addressing these conditions with your healthcare provider may help reduce symptoms. Other helpful strategies include elevating your legs during the day to reduce fluid retention, wearing compression stockings, and avoiding stimulants before bed. If nocturia persists, consulting a healthcare provider about medications like diuretics or desmopressin may be necessary to regulate urine production and decrease nighttime urination. 2. Elevate your legs before bed. Elevating your legs before bed is a simple yet effective technique to reduce nocturia, particularly for those who experience fluid retention in their lower extremities throughout the day. Sitting or standing for long periods can cause fluid to accumulate in the legs due to gravity. When you lie down, this fluid re-enters the bloodstream, increasing the amount of urine your kidneys need to process. By elevating your legs for an hour or 2 in the evening, your body has time to reabsorb and process these fluids before bedtime, significantly decreasing the need to urinate at night. This technique is especially beneficial for people with chronic venous insufficiency or heart failure, where fluid tends to pool in the legs during the day. Research shows that elevating the legs helps reduce swelling edema, which can decrease overall fluid load in the body. Additionally, this method can lower the risk of other health issues like leg cramps and deep vein thrombosis (DVT). Ensuring your legs are elevated above heart level by using pillows or a reclining chair can enhance fluid movement and improve overall comfort, leading to more restful sleep. 3. Try double voiding. If you're someone who wakes up frequently during the night to use the bathroom, double voiding might be a helpful solution for you. It's a simple technique that can reduce the chances of needing to urinate again after just having gone. Here's how it works. After you urinate the first time, don't rush back to bed immediately. Instead, take a moment to relax and let your body fully finish the process. After a few seconds, try to urinate again. It might sound odd, but this second round helps your bladder empty completely, leaving no leftover urine behind. When there's still urine in the bladder, it can cause an uncomfortable, nagging feeling, making you think you need to go again shortly after just using the restroom. Think of your bladder like a sponge. If you only squeeze it halfway, there will still be some water left inside. But if you squeeze it a little longer, you get all of it out. Double voiding is the squeeze that helps empty your bladder fully, allowing you to go to bed with less chance of waking up in the middle of the night. This technique is especially useful for older adults or people dealing with conditions like benign prostatic hyperplasia (BPH), which affects the prostate in men, or urinary tract infections (UT) that can irritate the bladder. As we age, our bladder muscles may weaken, or certain health issues can cause frequent urges to go. Double voiding can improve control over these urges and reduce unnecessary trips to the bathroom during the night. If you make this simple habit part of your nightly routine, you might find yourself getting more uninterrupted sleep. It's an easy change to make, but it can lead to big improvements in both the quality of your sleep and your overall well-being. Give it a try and see how it works for you. 4. Adjust your diet. When it comes to managing nocturia, the foods and drinks you choose can make a big difference. Believe it or not, your diet plays a key role in how often you wake up during the night to use the bathroom. Some foods and drinks can irritate the bladder, making you feel the urge to urinate more frequently, especially at night. Spicy foods, for example, are known to cause bladder irritation. If you love hot peppers or spicy dishes, you might want to keep an eye on how they affect your body. The same goes for acidic fruits like oranges, tomatoes, and even grapefruits. While they're healthy and tasty, their acidity can be tough on your bladder, increasing the likelihood of frequent bathroom trips. Artificial sweeteners, often found in sugar-free snacks or drinks, are another common trigger. They can cause discomfort in the bladder and make it feel like it's time to go even when it isn't. If you're not sure which foods or drinks might be causing your nighttime trips to the bathroom, try keeping a food diary. Write down everything you eat and drink throughout the day, especially in the evening, and see if you can spot any patterns. This will help you identify potential bladder irritants that could be keeping you up at night. A little self-awareness can go a long way in improving your sleep. Another important point is to avoid caffeine and alcohol in the evening. Both of these act as diuretics, meaning they stimulate your kidneys to produce more urine. While that morning cup of coffee might be just what you need to start the day, drinking it later on can have the opposite effect when it comes to sleep. Similarly, alcohol, while it may help you relax, can also lead to more bathroom visits during the night. Try to cut these out a few hours before bedtime for better results. It's also important to think about foods with a lot of water content, like watermelon and cucumbers. These are great for staying hydrated during the day, but eating them right before bed might lead to more fluid in your bladder overnight. To avoid this, aim to eat these water-rich foods earlier in the day. This gives your body time to process the fluids before you lie down for the night. In addition to avoiding irritants, focusing on an anti-inflammatory diet can help keep your bladder healthy. Foods like whole grains, lean proteins, and a variety of fruits and vegetables can support bladder function. A healthy weight is also important, as carrying extra pounds can put pressure on the bladder, making nocturia more frequent. By making small adjustments to your diet, you can take control of your body's signals and reduce the number of times you have to get up in the middle of the night. So, by being mindful of what you eat and drink, and when you have it, you can help reduce the chances of waking up to use the bathroom. Simple changes in your diet could lead to a more peaceful, uninterrupted night of sleep. It's all about listening to your body and giving it what it needs to stay comfortable. 5. Train your bladder. One effective way to tackle frequent nighttime urination is by training your bladder. Bladder training works by gradually increasing the time between bathroom visits during the day. The idea is to help your bladder get stronger and hold urine for longer periods, which can lead to fewer trips to the bathroom at night. Here's how you can get started. If you find yourself heading to the bathroom every hour, try holding off for just a few extra minutes before you go. It might feel a bit uncomfortable at first, but that's okay. For example, if you usually urinate at 1 o'clock, try waiting until 1:10 before you go. Once you're comfortable with that, you can increase the time again, maybe to 1:20, and so on. Over time, your bladder will learn to hold urine for longer, which means you won't feel the need to go as often during the night. This method doesn't provide instant results, but with patience and consistency, you'll likely notice fewer nighttime interruptions. Research published in the Journal of Urology showed that patients who practiced bladder training had fewer nocturia episodes than those who didn't. It's important to stick with it, even if you don't see immediate improvement. Just like any kind of training, whether it's for your muscles or your bladder, it takes time and effort to build strength and endurance. One thing that can help you stay on track is keeping a log of your urination patterns. By writing down the times you go to the bathroom, you can track your progress and see how much longer you're able to wait each day. This log not only helps you measure your success, but also keeps you motivated as you see improvements over time. You might be surprised by how much you can gradually extend your intervals with just a little persistence. Bladder training can be challenging at first, especially if you're used to frequent trips to the bathroom, but with small, consistent steps, it can make a big difference in how often you wake up during the night. With practice, you'll be teaching your bladder to be more patient, which can lead to a more peaceful night's sleep and less disruption overall. Remember, it's all about taking it slow and being kind to your body as you work through the process. 6. Check your medications. Certain medications can contribute to frequent nighttime urination, particularly diuretics and drugs with diuretic effects. Diuretics, often prescribed for conditions like hypertension or heart failure, increase urine production, which can interfere with sleep. If you suspect that your medications are affecting your nighttime urination, consult your healthcare provider. They can assess your regimen and suggest possible adjustments, such as altering the timing of doses to reduce nighttime symptoms. Research from the American Urological Association highlights that taking diuretics earlier in the day can help the body process fluids before bedtime, potentially reducing nocturia. Additionally, other medications, such as certain antidepressants and corticosteroids, may also impact urine production. A healthcare provider can suggest alternative treatments or lifestyle adjustments to help manage nocturia. 7. Stay active during the day. Regular physical activity is a crucial factor in managing nocturia. Exercise helps your body process fluids more efficiently, preventing fluid accumulation in the legs, which can lead to increased nighttime urination. Aim for at least 30 minutes of moderate exercise most days, whether it's walking, cycling, or swimming. Strengthening the pelvic floor muscles through exercises like Kegels can improve bladder control and reduce involuntary leaks. Maintaining a healthy weight is also essential, as obesity can contribute to urinary problems. According to research from the American Urological Association, individuals who stay physically active tend to experience fewer urinary issues. Exercise regulates hormones, improves circulation, and supports overall bladder health, making it a powerful tool in reducing nocturia. By incorporating these strategies into your routine, you can take control of your nighttime urination and improve your sleep quality. With a little effort and consistency, restful, uninterrupted nights are within reach. 8. Establishing a bedtime routine for better sleep. Creating a consistent bedtime routine can significantly enhance sleep quality and help manage nocturia, or frequent nighttime urination. When you go to bed and wake up at the same time each day, you regulate your body's internal clock. This synchronization supports various bodily functions, including bladder control, making it less likely that you will wake up multiple times during the night. One of the best ways to improve your sleep quality is by incorporating calming activities into your evening routine. Reading a book, taking a warm bath, or practicing relaxation techniques such as deep breathing or meditation can help reduce stress and promote restful sleep. Stress and anxiety are common triggers for nocturia, so creating a peaceful environment before bed is crucial. On the other hand, it's equally important to avoid stimulating activities before bedtime. Exposure to electronic devices such as smartphones, tablets, and televisions can interfere with your ability to fall asleep. The blue light emitted from screens suppresses melatonin production, a hormone essential for regulating sleep. According to the National Sleep Foundation, minimizing screen time in the hour before bed can improve overall sleep quality. Research from the Cleveland Clinic also suggests that individuals who establish a relaxing nighttime routine experience fewer interruptions during sleep. Another essential factor in managing nocturia is adjusting your fluid intake before bedtime. Consuming excessive fluids in the evening increases the likelihood of waking up to use the bathroom. By reducing the amount of liquid you drink a few hours before sleeping, you can decrease nighttime urination. Avoiding caffeine and alcohol in the evening can further prevent disruptions, as both substances can stimulate bladder activity. Engaging in regular physical activity during the day can also support better bladder health and overall sleep. Exercise helps regulate bodily functions and reduce stress, both of which contribute to more restful sleep at night. However, it's best to avoid vigorous workouts right before bed, as they can increase alertness and make it harder to fall asleep. By consistently following these strategies, establishing a set bedtime, limiting fluid intake, incorporating relaxation techniques, and staying physically active, you can significantly improve sleep quality and reduce nighttime bathroom trips. Maintaining these habits over time leads to better overall well-being and a more uninterrupted night's rest. 9. Manage underlying health conditions. Nocturia is often linked to medical conditions such as diabetes, sleep apnea, or prostate issues. Managing these underlying health conditions effectively can significantly reduce nighttime urination and improve sleep quality. For individuals with diabetes, high blood sugar levels can lead to excessive urine production. Proper blood sugar management through a healthy diet, medication, and regular exercise can help minimize nocturia episodes. Additionally, sleep apnea, a condition where breathing stops and starts during sleep, can cause frequent awakenings and urination. Treating sleep apnea with a CPAP machine or other interventions can lead to more restful sleep and reduce nighttime trips to the bathroom. Prostate-related issues, particularly in men, can also contribute to nocturia. An enlarged prostate can put pressure on the bladder, making it difficult to fully empty and causing frequent urges to urinate. Medications or lifestyle adjustments can alleviate symptoms, improving both bladder control and sleep quality. 10. Maintain a healthy weight. Excess weight, especially around the abdomen, can place pressure on the bladder, increasing urinary urgency and frequency. Studies have shown that even a moderate weight loss can relieve bladder pressure and decrease nocturia episodes. Obesity is also associated with metabolic disorders and insulin resistance, which can exacerbate bladder issues. By maintaining a healthy weight through balanced nutrition and regular exercise, individuals can improve bladder function and reduce the frequency of nighttime urination. Regular physical activity not only supports weight management but also enhances circulation and fluid balance in the body. Strengthening the core and pelvic muscles through exercises like yoga or pelvic floor workouts can further promote bladder control. Adopting a lifestyle that includes hydration control and proper meal timing can make a significant difference in managing nocturia symptoms. 11. Reduce stress and anxiety. Stress and anxiety can have a direct impact on bladder function, often worsening nocturia symptoms. When stressed, the body releases hormones that can increase bladder activity and muscle tension, making the urge to urinate more frequent. Chronic stress can also exacerbate overactive bladder syndrome. Engaging in relaxation techniques such as deep breathing, mindfulness meditation, or yoga can help calm the nervous system and reduce nighttime urination. Establishing a bedtime routine that includes light stretching, journaling, or listening to calming music can also help ease the mind and improve sleep quality. By managing stress effectively, individuals can minimize nocturia symptoms and enjoy a more restful night. 12. Consider medical treatments. If lifestyle modifications do not sufficiently improve nocturia, medical treatments may be necessary. Several medications are available that can help reduce nighttime urine production and bladder overactivity. Doctors may prescribe desmopressin, which helps regulate urine production overnight. Other medications such as anticholinergics or beta-3 agonists can help relax the bladder muscles, reducing urgency and frequency. For individuals with more severe cases, advanced treatments like Botox injections into the bladder or nerve stimulation therapies may be recommended to help retrain bladder function. Consulting a healthcare professional is essential for determining the best course of action based on specific needs. With proper medical guidance, Nocturia symptoms can be effectively managed, leading to better sleep and improved overall well-being. If you are looking for additional ways to manage Nocturia, we recommend checking out our video on the top 3 medications that can help treat this condition. These treatments may significantly reduce your nighttime trips to the bathroom and improve your overall sleep quality. The insights shared in the video could be a game changer for anyone struggling with frequent nighttime urination. Be sure to watch it to learn how these medications work and how to integrate them into your daily routine effectively. Thank you for joining us in exploring effective ways to manage Nocturia. We hope these tips empower you to achieve more restful sleep. If you found this information helpful, please subscribe to our channel for more valuable content on health and wellness. Remember, before making any significant changes to your routine or starting new medications, it's essential to consult your doctor. We'd love to hear from you. Please leave a comment below with your thoughts or questions. Your feedback helps us improve and continue creating informative content to support your well-being. Until next time, take care of yourself and rest well. Goodbye, and we look forward to seeing you in our next video. If you enjoyed this video, please like and subscribe to support our channel. Your support means a lot to us and motivates us to continue producing valuable health and wellness content. Thank you, and goodbye.